I am Jasmine Perez. I am a certified nurse midwife in the United States in New Jersey. A certified nurse midwife is a nurse who has studied an extra 2 to 3 years, depending on the facility, to become an advanced practice nurse. As a nurse midwife, I practice autonomously in the hospital, seeing my moms, taking care of anything from triage area where you come in to kind of determine if you're in labor or if you're worried about your waters being broken. I do all of the care throughout the labor and manage the labor myself. If there's any complications, I consult with the physician, but they don't have to be in my room for a delivery unless I ask them to. I also do postpartum care, see moms postpartum, and if for some reason my mother needs to have a cesarean section, I also first assist in the hospital and assist the physician with the surgery. Just to give a little bit of history, when I first started at my hospital, which is called AtlantiCare Regional Medical Center in Pomoně, New Jersey, that was about 12 years ago. They didn't have birthing balls, they didn't have peanut balls, they didn't really have anything. They did have hydrotherapy tubs built into each of our rooms, but they were never used. And so I taught the nurses how to use the tubs and the different shower heads to provide hydrotherapy for women who want non-pharmacological pain relief methods. I also introduced birthing balls and peanut balls, wireless monitoring so that women can be mobile, and also the wireless monitors are waterproof so they can be in the water if necessary with these monitors. I also introduced aromatherapy and diffusers so that women can have this option to help calm the environment in their labor rooms if they have anxiety or just need to kind of energize the environment, especially if they're nervous about being in a hospital setting, because for a lot of our women, that is the only option. Home birth is available, but very limited, as we only have 2 home birth midwives servicing a very, very large area. And we do not have a birth center close by. The nearest birth center is probably about 1.5 hours to 2 hours away. And it is an out-of-pocket expense. It's not always covered by insurance. Home birth, for instance, costs about $8,000 US. And in some places like New York City, it can even be higher. And for the population that I serve, that's not always accessible. One of the things that I found really heartbreaking when I first started working as a midwife at my facility is that the C-section rate was about 44%. It was happening pretty often. I feel like very electively, kind of at the mercy of the women, and really for the benefit of the physician according to what their schedules were and what are the things they had happening. Some of our private physicians aren't in-house in the hospital, and so they have to see women in the office for some of their gynecological visits and prenatal visits, and so they oftentimes could not be available to provide the labor support and often coerced women into cesarean sections. Because of some of the resources that were added to the labor floor with my help and with education to the nursing staff that really we work collaboratively with, we were able to decrease our C-section rate, especially for primiparous women who we really want to make sure they have better outcomes for future pregnancies. We've decreased it to about 23%. We still have a lot of work to do, but that is a very, very important indicator for us at my facility, really supporting primiparous women and their families, and also for those who have had to deliver by cesarean section. We are one of the only facilities that really supports vaginal birth after cesarean for our mothers, and we encourage them always to at least trial a vaginal birth. We call it a trial of labor after cesarean, in hopes that we can decrease morbidity and mortality for these women. In my experience, especially in the operating room, things can go really bad really quickly, even for women that are super, super healthy. There's so much that we don't know in relation to how surgery happens, why the woman is in these particular positions. But I've seen hemorrhages, I've seen uterine ruptures, I've seen, 18-year-olds need hysterectomies because their body cannot support the loss of blood and all the complications that can arise in surgery. So I really advocate for normal physiologic birth. It's very, very important for doulas and midwives to collaborate together and work together to really support these women and empower them so that they have faith and trust in their own abilities, so that we can have more women having normal vaginal deliveries and decrease the cesarean section rate even more.